gonna come after you. You're gonna come before mine. Yeah, we don't want any spankings.
Everyone put your phone on silent.
So Frankie, where's Frankie? Where's Frankie? Okay, come on, because you're gonna come after me, Frankie. Okay, and then right here you have Frankie. That's Frankie. Okay. And then after you.
Okay. How you doing, Dad? Yeah, I'm excited. Yeah, I'm always excited when I have to speak, you know.
Are we ready?
It's your first time?
We ready? Good afternoon. I am Reverend Glency Redrick, co-chair of the Charlotte Clergy Coalition for Justice. We stand here this afternoon to send a clear and urgent message to our leaders in Congress, those who believe is somehow justice to starve millions of American families while enriching the wealthy who profit from the very people they oppress. Some of these leaders even call themselves Christians. But if that is the case, I have to ask, what Bible are they reading? Because the Bible I know speaks of feeding the hungry, caring for the sick, clothing the naked, and tending to the needs of the poor. It commands compassion, not cruelty. The Christianity they are practicing is one of malpractice, one without moral or spiritual accountability. Yes, we are not without hope. There are leaders who do read and live by the same sacred texts, who see justice as love in the public. And they are standing here with me today, local officials, state officials, and national voices committed to right action and righteous resistance. Amen. Together, we declare war on food insecurity, on unaffordable health care, on inadequate housing, on lost wages, and on the abuse of power that strips the dignity from our communities. We will not be silent while families are harmed, while homes are raided, children are zip-tied and torn from their parents, and human beings are treated as disposable. As Dr. William Barber reminds us, we have a moral authority to be here, and so we are here to speak truth, to lift our voices, and to stand in the key of justice until justice rolls down like water and righteousness like an ever-flowing stream. Yes. We are here today to sound the alarm. Amen. And so I would like to have one of our impacted speakers come up and speak to this very reason why we're here. And I'm asking Frankie if you would please come forth.
Amen. Amen. Good afternoon. Good afternoon. I'm here today. I'm a senior warrior with Action, North Carolina, and I'm here to speak some truth to this situation. And that's what it needs to be. People, the actions that the government is taking is harming everybody, all Americans. It's harming black, white, it's harming everybody. Things are bad for working blue-collar working class people that don't even get food stamps. Food is so high. And then you're going to cut food stamps? You're going to cut food stamps? And then you say you're a child of God? And then you're going to starve children?
Shame.
I can say throw out the bathwater, but don't throw the baby with it. You know what I'm saying? Look into the situation. but do it with the surgeon's skill. If you're going to cut like a skilled surgeon. You know, because it is what it is. But it's wrong to starve people. It's wrong to keep people from going to the hospital if they can't go to the doctor. I remember a time people couldn't go to the doctor because they didn't have any money. And people died. Is this what you want for America? Who are you going to have to work for you? Huh? Huh? I asked you that question. Who are you going to have to work for you? You know, you're lining your pockets. But you know what? There's a higher power that sees everything that's going on. That's looking to and fro in this earth. And they're looking at America. It's time, America. You talk about make America great. Is that code for make America rich, for the rich only? Because I can't say make America white because white people are being harmed just like black people are. You turn your backs on the very ones that voted for you. And so now it's time. It's a reckoning time. When we're going to open our mouths, I'm going to open my mouth as long as I have breath in my body. But fight for injustice. You know, inequality. Immigration, dragging people out of their homes. That's wrong. It's wrong. You're going to starve people to starve them to death. Are you Marie Antoinette? Let them eat cake? Are you so unaware of what's going on? And the people are starving. You say let them, they have no bread. Let them eat cake. Is that what you're saying? Government of the United States? Cabinet members? Judges? Supreme Court? I'm talking to all of y'all. That's it. I'm done.
Thank you, Frankie. My name is John Cleckhorn. I'm the pastor, Reverend John Cleckhorn. I'm the pastor of Caldwell Presbyterian, but I think we've already heard the sermon. But speaking as a Christian, we follow a man who spoke plainly about the fundamental responsibility to care for each other, for one another. He said clearly, "For I was hungry, and you gave me something to eat. I was thirsty, and you gave me something to drink." What he did not say is that when I am hungry, it's okay if you force me to choose between taking the medicine I need and feeding my child, or to skip dinner again so that I might have enough to pay rent so I don't get evicted this month, or to know that there is a food bank just down the road but not have the gas to get there. In this country, no one should go hungry. Amen. But those are the impossible choices millions of Americans are making today. We ought to be ashamed. We ought to be ashamed when in this land of plenty our leaders go so far as to hoard for the few. We ought to be ashamed when working people are treated as nothing but political pawns. We ought to be ashamed when our government says it will go as far as the Supreme Court to keep hungry people hungry. Earlier today, I had lunch with a longtime church member. We were just visiting after not having seen each other for a minute. And he gave me a silver dollar as a token of our longtime friendship. It says right here on it, "In God we trust." I wonder what God thinks these days about how we show that we actually do trust God enough to do what God expects, to recognize the abundance in America and use it to feed our neighbors, house the unhoused, to heal the sick. A coin is a promise by the government that it can be trusted to take care of human need. It's high time that that promise was kept for the working people of America. It's my honor now to introduce Representative Alma Adams.
Well, thank you, Reverend, and thank you, Dr. Glency, and to the coalition, and to all the elected officials who are here today. Let me just, I know we can all count. This is the 41st day of the government shutdown. And that means that for 41 days, 7,000 federal employees in my district have gone without pay. 41 days, the Charlotte-Mecklenburg residents experiencing pauses and delays as they are seeking services from the government. And at this time, all of this time, Speaker Mike Johnson refused to call the House back into session so that Congress can get back to work. We need to get back to work and shut down the shutdown. Now, the American people are expecting Congress to do our jobs, the jobs that we were elected and appointed to do. Last night, though, it seems that the Senate came to a deal to reopen the government through January 30th. Now, it doesn't have everything it needs to have in it, but I'm going to tell you what's there. And I haven't read it yet. When I get back to Washington this week, I'll have a chance to go through it and to look at the fine print, because I'm sure that there's some fine print there. Yes. But the bill would tentatively, first of all, ensure that full SNAP payments, 100%, be issued. Would also allow my constituents to receive the federal services that they need. And then it would prevent those 7,000 federal employees in my district from being fired through this reduction in force notice through January. And so it will also provide that those who have been fired will be rehired. And they will be able to continue to work because it was no fault of their own that they were fired. Now, but that bill still does not address what was at the center of the fight, the Affordable Care Tax Credits. We're still concerned about that because, as you have heard, not only do people need to eat, but people need health care. Yes. And they need health care that it shouldn't just be accessible, but it's got to be affordable. Yes. Because if you can't afford to pay for it, then that means you don't have any health care. But this bill, this CR that's coming out of the Senate, and we think maybe tonight, does not address this particular fight that we've been in for the past 41 days. 880,000 North Carolinians rely on the ACA tax credits so that they can afford health insurance, including 88,000 in my district, in the 12th district. Open enrollment, as you know, began November 1st, and for the citizens who are in the marketplace, hundreds of citizens, they have called to my office to let me know that their insurance premiums are not only going to double, but they're going to triple. They are skyrocketing. And so one constituent called to share that their family is expecting to pay $10,000 more next year to keep the current coverage that they have. And so, because Republicans refuse to act. Now, I want to be clear. This bill hasn't passed the Senate. That's the CR that's in the Senate right now. And even if it does, it will still have to pass the House. You know, we have the House and we have the Senate. And I represent the 12th district in the U.S. House. And so a lot could change during that time, between tonight and this afternoon and the time we get back and the bill comes before the House. But I've got to tell you that this shutdown continues to inflict pain on the American people, from SNAP cuts to cuts in federal firings and delays at the airport, but that's nothing new for them. And this attack on health care, let me just tell you, it didn't just begin when the shutdown began. Because if you think back in July, Republicans passed that one big ugly bill. They call it beautiful. Nothing beautiful about it. It just hurts a lot of beautiful people. And that bill cuts $1 trillion from Medicaid. So when we talk about health care, yes, it's about the tax credits, but yes, it's also about Medicaid. And so our state government had to balance the budget to compensate. We've got a representative here, Aisha Du, who knows what I'm talking about. They're going to have to balance that budget, and what that means that they're going to be cutting funding for providers. And you know what that means for Medicaid patients? Providers are not going to want to care for you. They're not going to want to take you. So that's a real problem. Unless Congress acts, our country's health care crisis is going to get worse. And while they're going to bring a bill before us, that bill does not do everything that it should do. And then when we look at the problems with health care and the African American community, and I'm speaking specifically of Black maternal health. I am the co-founder of the Black Maternal Health Caucus, and I can tell you that in North Carolina, Medicaid access was expanded to over 700,000 people. That was in just 2023, and so we extended the postpartum Medicaid coverage by 12 months. But despite these wins, the maternal mortality rate for Black women hasn't changed. So that means that 4 out of every four African Americans are 4 times higher to experience death in birth, women, than anyone else. And so we've got to push harder forward, not backwards. 65% of Black births are covered by Medicaid. So when you think about Medicaid and not only the impact that it has on food, because certainly you can't be healthy if you're hungry, so we've got to make sure that we feed people. Now on top of that, we've got to think about WIC. That's women, infants, and children. Those benefits are running out as well for most of the vulnerable moms and babies. And so this president and this administration, they want to continue to hurt people. I mean, look at how many doggone times he has been to the courts to try to keep from giving people their SNAP benefits. I mean, why do you want to keep people hungry? We're talking about the people who need that support. And I can tell you that people on SNAP, they work. But they're working 2 and 3 jobs. They can't make the ends meet. And so working hard is not enough if you don't make enough. And so our government needs to understand that people who get these benefits are entitled to these benefits. They need these benefits. Well, hell, let's raise the doggone minimum wage so people can earn a living wage, and then they don't have to come and get support from the government. But those are so many things that we have to work on. But let me just say that this contingency plan, which is already in place, allocates the dollars to pay for SNAP. And I'm hoping that even though this afternoon the district court, the Supreme Court said, well, no, we're not going to, the general court, I mean the district court decided that the president and the administration should pay 100%. Well, based on what he's done, based on his practices, he's probably going to try to go back to the Supreme Court and appeal. But that was a rule by the circuit court. But if this gentleman, I'm going to call him that, we hope he'll be that one day, but if Trump worked half as hard to bring Republicans to the negotiating table, as hard as he's worked to block SNAP benefits, to keep people hungry, then we would have reached the deal long before last night. And so I'm calling on all of my Republican colleagues and the Trump administration who are weaponizing people to let's give some slack here. Let's look at the suffering and the pain. Let's have some compassion. You've heard it. There are more than then I believe, and all the ministers are here, but I think I'm right when I say that there are more than 4,000 references in the Bible that speak to how you treat the poor. And yes, I can tell you, the Lord's just not happy with what's going on right now. But let me just say, everybody deserves to eat, and everybody deserves to have the health care that they need. I'm going to continue to fight to ensure that no one goes to bed hungry at night, that everyone has a decent, affordable place to live, that we can have health insurance. It is so, so critical, because I've got to tell you that while these premiums are going up on the people who are on the ACA, it's going to go up for everybody. We're all going to have to bear that brunt, and probably we should if that's the case. But I'm going to continue to push for this extension on these tax credits. We need that. I'm not sure what's going to come out from the Senate and what the House will finally vote on. But I want this community to know, and all of the folks who are standing here to know that we're going to continue to fight. I'm going to continue to stand up. I'm going to speak up. I'm going to cut up if I have to. But it is important that we speak out. So I'm just so happy to see so many people here today, because the federal government needs to understand the impact that not only that the shutdown is having, but the reason for the shutdowns, and the impact that it's having on citizens. And I thank you for all of you for being here. I thank the organizers, my sister here, Aisha Du, to the coalition, and all of you. Thank you so very much for allowing me to put my 2 cents in today. Amen.
Good afternoon, everyone.
Our county commissioner, the people's man.
All right. Thank you to our great Congresswoman, and to Representative Du, to all of our neighbors and friends who are here, our clergy. Let me just say thank you, number one, for organizing this. This is an important topic. My name is Mark Jarrell. I serve as chairman of the board of the County Commission here in Mecklenburg County. A few things that I just want to say, and I want to make it clear. People matter. Amen. People are not ping pong balls. Yeah. They should not be leveraged or used as pawns in any way. Amen. For the last 41 days, people have been scared. They're trying to figure out and making choices between food and lights, utilities, and for us in the government, our main responsibility is to take care of people. That's our main responsibility, to keep them safe. Food should not be used as a bargaining chip. To Congresswoman Adams' point, the vast majority of people that are on SNAP or receive SNAP benefits are working. Yes. What that means here in Mecklenburg County, that's 63,000 households, or 138,500 individuals. That goes from children all the way to our most seasoned individuals that live here. And so I want to make it very clear that Mecklenburg County cares about its people. And what you see represented here today goes beyond Mecklenburg County. This is a representation of what's happening across the state and across the country, to our Congresswoman's point. And so it is time for us to understand that policy matters. Policy impacts people. And we're always going to stand on the right side of policy. And any time that we are saying that people can starve, that's the wrong policy. Make no mistake about it. We want to move to a space in this community where people don't need a food box. We want to move to a space in this community where people don't need SNAP benefits. Yes, if we raise the minimum wage, people should have a livable wage. People should have a livable wage. We have to do better. And so that's where you'll see policy. Mecklenburg County has leaned in. We've convened partners. And I want to thank all of our partners, all the people in this community who have stepped in and stepped up and said, listen, we're going to lean in for our brothers and sisters. We don't know them, but we're going to lean in. And so I want to publicly thank them. I want to thank everybody behind me for their work, for staying in the fight, for letting their voices be heard, for speaking up and speaking out, and not being afraid because there's threats coming from D.C., the same people that should be protecting them. And so we're going to continue to do that. I'm here to say thank you for this opportunity. Mecklenburg County will continue to fight. Thank you.
Hey there. So Representative Aisha Dew here. Listen, we were called back to Raleigh to do a remap gig as opposed to deal with Medicaid rebates. We went back because someone on the other side of the aisle decided that they wanted to potentially get Donald Trump's endorsement. What we want to do is to get the people's endorsement to make sure that they have the food that they need and to make sure that they actually have the health care that they need. So I commend Governor Stein for all the work that he's done to pull together public and private partners to make sure that people can eat. Also for all of the folks doing the work at the county, for Congresswoman Adams, handing out food. This is where we are now because we can't get our colleagues to do the work together to actually come up with a real solution, which is to give people their benefits back. Congresswoman Adams, as she mentioned to me the other day, when you look at what people get, some of them are only getting $23 a month, and they work 2 or 3 jobs, right? I saw mothers on television crying because they skipped meals so that they can make sure that their children can eat. And they were already doing that before the benefits were cut. So we need to make sure that the government works for the people and not have the government just work on its own behalf for something we don't know they're trying to accomplish besides starving children. It's time for us to get back to work. We have not passed a budget. We had a pretty good budget that we actually produced on the House side and the North Carolina General Assembly, but we can't really get the Senate to come to the table. Yet again, this is about political party politics as opposed to what we need to do for the people of North Carolina. We need to convene, so I'm grateful that Josh Stein has called us back, that Governor Stein called us back to specifically deal with the Medicaid rebates. Hopefully, we can actually also get to a budget and not continue with the previous budget that we had, but actually meet the needs of the people right now. We have a job to do, and we're one of the last states to even pass a budget. So we need to get it done on behalf of the people of North Carolina today. So I'm so grateful for everyone being here, for all of my clergy colleagues, for Congresswoman Adams, for County Commission Chair Mark Jarrell, for all of my people from Action NC. Thank you so much for being here and standing in solidarity on behalf of the people. We need to get the government back to work in North Carolina, and we need to get the government back to work at the federal level. It's time for us to get to work on behalf of the people. We have one job. That's right. Thank you. Thank you. Did you all have any questions?
Can you just talk about the SNAP benefits that you were saying? Can you just elaborate? The Senate is on its way to pass and it goes to Congress. Just talk to us.
Well, we call it a CR, right? A continuing resolution, and basically there have been some adjustments to the initial CR that the House passed, and that the Republicans, it was a Republican CR, by the way, and this is a Republican shutdown, let me just say that. But if the government gets back open, the SNAP benefits that are supposed to be issued will go forward. I'm not sure, even if that happens, whether the president, because you know he's an ornery guy, whether he will then go to the Supreme Court, because the first time he went, he asked for a stay, a temporary stay, if you recall, And Judge Brown, Chief Justice Brown, said, okay, well, let's do a temporary stay. And it was 9:30 p.m. They decided they would hold off for a while. It went back to the circuit court, and the circuit court came back today and says, okay, what we said the first time was what we want you to do, give 100%. But this president, he wants to kind of do whatever he wants to do, and he's mean-spirited, and so he may just decide to now go back to the Supreme Court and ask for a permanent stay, and that's what I'm hearing he may do. But if this if the Senate gets this thing passed, and if it clears the House, I'm not sure. Like I said, I don't know what my colleagues are going to do. I don't even know what I'm going to do. I need to read it. I need to see what's in it. I need to see the fine print. I am very distressed that there's no reference to health care, to the ACA tax credits. So I guess it's all up to the president if you think about it, because the speaker has not held the president accountable for anything. They're just letting him run wild. He's just running rogue, do whatever he wants to do, and they're going along with it, because the speaker should have called us back a long time ago. The Democrats, we've been in and out of Washington for several weeks. Republicans have been on vacation. Donald Trump's playing golf. So that's what's going on.
Thank you.
He's going to do something. All right. Thanks, everybody.
Hector, can you get a picture for me?
Yeah, whoops.
Y'all, let's get a picture before we head out. Okay.
She's sitting down.
Hector. Yes, everybody's together.
I'm coming over with you.